Hello friends, this is Dr. Greg Wheeler from CCC Health, where we specialize in primary care, pediatrics, wellness, functional medicine, and holistic health. Our subject today is back pain, that little tweak that starts out as an annoyance, but can grow to a very painful condition that can sometimes last for weeks.
Hello everyone, this is Dr. Greg Wheeler. I'm sitting here in my office here on Cutsdown Road. This is our new office, CCC Health, which we opened up in May. And I wanted to take this opportunity to talk with you today about a very important topic in medicine that we see. I think every one of us has a friend, a relative, coworker who we see them that morning and they're like, man, my back is just killing me. Well, I'm glad we're able to talk about that because it is a very significant problem in our society. There's approximately 3 out of 10 Americans that suffer from low back pain. That's over 72 million Americans. And this can be chronic in nature at times, lasting more than a couple days, sometimes weeks, sometimes months, or even longer. 37% of these, roughly 1/3, really haven't been explained to them, what is the cause of their low back pain. A lot probably the majority wish they had a better explanation. The medical journal, The Lancet, recently reported a couple problems that persons are getting from their healthcare providers concerning back pain. Bad advice, inappropriate tests, sometimes even recommendations for risky procedures. And then, unfortunately, painkillers, some that are needed in a short-term situation, but a lot that show other harmful side effects if used long-term. Who are the persons most at risk for low back pain? Well, it would be people who have physically demanding jobs, or it can be people who are in the office all day and just don't keep a very good posture. Certainly, weight, obesity is another potential risk factor. If you're carrying around that weight all the time, well, that's going to be more strain on the ligaments, the tendons, and the connecting tissue. And then certainly persons who smoke. Smoking can cause microvascular disease, and so your tissues don't get the nutrition that they need, and so they get weak. But we do see that the majority do respond to things like physical therapy. And we really need to keep active. We need to keep going. We don't need to just sit around and hope that things are going to get better on their own. So that can be very important. Now, unfortunately, we do get some recommendations which, again, are kind of the mainstay of treatment for low back pain. Things such as anti-inflammatories, or NSAIDs, or non-steroidal anti-inflammatory. And these do work good in the short term. However, they do have some side effects, some problems associated with them. Certainly, if anyone has taken ibuprofen for several days, can attest to having stomach pain, GI upset, and if taken longer term, it can result in things like gastrointestinal bleeding. And also problems even with our platelets and with our clotting factors. And we do see in studies that some of these anti-inflammatories, these NSAIDs, can even increase our risk of cancer, of stroke, of heart disease.
Thank you for this opportunity to scratch the surface on back pain. Although the treatments have some drawbacks, there is a promising future. We at CCC Health recognize the amazing herbals and natural products that exist in nature to assist our bodies in the healing process. We don't have to see the surgeon or stick solely to pharmaceuticals that sometimes have their place in certain instances, but oftentimes have some difficult and potentially dangerous side effects. Join us next time as we talk about a specific herbal medication with incredible promise, not only for back pain, but for a host of other disease processes as well. And until next time, may we all strive towards good health and wellness. So long.